To talk about where India is in the fight against the coronavirus and what could happen over the next few days, I'm joined by Brahma Mukherjee at the Department of Biostatistics, Professor of Epidemiology at the Global Public Health University of Michigan. Welcome. With us also is Matthew Fox, Professor in the Department of Epidemiology and Global Health at Boston University. Dr. Shamika Ravi joins us. She's a public health expert and economist. Welcome to our guests. But before I go across to them, I want to show our viewers where we stand. Where is the curve? Remember, the big effort all of us are making together is an effort to try and flatten the curve. So I'll show you where we are at and where other countries are when it comes to the coronavirus curve. Now, this is the curve in India. It was growing very fast till before the lockdown was imposed. After that, there's been some kind of a petering off. Now, will this last beyond the lockdown? Is this just because of the lockdown? We'll ask our guests that question. This is China, the yellow curve. You can see it's skyrocketed. It's still the biggest curve in the graph, but then now it's plateaued off. From the last several days, it's a very, very flat curve. The other curve, which is very flat, which skyrocketed, is this blue curve, which denotes South Korea, a skyrocketing curve. Then they've managed to flatten the curve, and we'll ask our guests what are the lessons from South Korea. Then there is Italy, which is really a mess. If you see the rate at which that green line is growing, Italy will very soon overtake China and become the hotspot. But the biggest problem right now is in the United States, where the curve completely seems to be out of control. In fact, if you see this purple line, it's gone beyond China and the curve isn't coming under control. And what you saw yesterday was Donald Trump say, you don't need a full lockdown. Those who are symptomatic are being asked to stay indoors. It's a very, very loose quarantine in comparison with what we're seeing in India. I want to show you some more data sets. This is now coming up on your screen. That last 24 hours and how many cases we've seen in India. In the United States, there have been, look at this carefully, 18,695 cases reported in the last 24 hours. China, it's down to 134, and in India, it's 149 cases. I want to go first and foremost on this broadcast to Brahma Mukherjee. Professor, welcome. I want to understand from you, as far as your understanding of where we are at in this battle against the coronavirus is concerned, how do you think the first 5 days of the lockdown have been? You're looking at the data trends on a more macro level. How is India's battle against this dreaded virus going in your view?
You know, this is a very daunting situation for any policymaker because there are multiple objective functions that you're trying to balance. I almost feel that public health and economics are pitting against each other because there are hardship of humanity. So it's not a very simple decision. The mathematical modeling that we have done only talks about the epidemiologic costs and the costs due to coronavirus, but there are societal costs which are enormous and incredible. So which process of lockdown is going to work for India? It's very hard to predict from mathematical models which are not contextualized, particularly this mobilization efforts that ramping up testing is incredibly important. I'm really concerned about the migrant workers moving because the goal of the lockdown is actually to hold the population at a static level and do random testing, surveillance, expand our healthcare facilities so that we can get prepared for the war. So I think it's a very hard question how the lockdown is going.
Dr. Shamika Ravi, your thoughts on how the lockdown has been going? You've been rather positive in the posts that you've put out that India could potentially get the better of the virus. Where is it that you're drawing this positivity from, Dr. Ravi?
Well, first of all, it's important to realize, Rahul, that a lot of the epidemiological models that we have seen so far, which have given us very alarming numbers, have used a lot of the parameters at the early stage of the outbreak in some of the hotspots globally, right? So, but no country is really sitting idly, and particularly in the Indian case, and everywhere this is a dynamic situation. In the Indian case, the government was extremely proactive, if we now think from a hindsight, that as of middle of Jan, they started airlifting and evacuating people from Wuhan, and then subsequently Milan and elsewhere. But what we can see in the data is, if you see the early growth rate of the cases, then you were seeing that India was doubling every 3 years. If you just look at the initial growth rate,
3 days,
and you
not
every
years.
3 days. Sorry, every 3 days. And what happened after? We are seeing the data as of March 23rd, is that really began to flatten a little bit in terms of the growth started to double every 5 days. Now, if you consider that the incubation period of this virus is about 10 days, then you are noticing that these might have been measures taken around, 10th or 12th of March. And when we go back and start to look at what the government did at that point in time, much before, I think, any other country, very, very strict travel bans from many hotspot countries. Schools and colleges were shut down. In fact, some states also invoked the 125-year-old, the Epidemic Disease Act. And I think, so the data which shows the relative flattening from 3 days to 5 days, it's basically telling us that, as of yesterday or today, when the number is 1,070, if it had been tripling, doubling every 3 days, right now the number should have been around 2,200, right? So there is considerable flattening. However, I do want to caution that there are so many moving parts in this, and particularly now this, the probability of community outbreak with this massive reverse migration happening back to rural areas, we could very quickly undo a lot of these early gains as well.
Okay, Matthew
Right?
Fox, you're looking at India, you're looking at other countries. In your view, how does India fare in comparison with other countries that are currently battling the coronavirus?
Well, so far, India is quite a bit ahead of many other countries, particularly here in the United States, because India has taken steps to start a lockdown much earlier than we did. And as your other guests have pointed out, the numbers are far lower in India than they were early on in China or here in the United States or in Europe. And I think that is in part because of the steps that are being taken to distance people. I would agree with the other guests, though. I think you need to be a little cautious in trying to predict what's going to happen next, because there is a delay of about 14 days between the time at which you implement a strategy like a lockdown and the time at which you're going to see the results. So it's premature to say whether or not the situation is going to be stabilized in India, and then to start to think about what the long-term plan is in terms of how long you keep people distance from each other. But so far, I would say the measures that have been taken certainly are a step in the right direction.
Now, Dr. Shamika Ravi, the one thing that's been spoken of in the Indian context is the fear that a sense of complacency may set in. If these numbers stay relatively calm and low, people may think, okay, maybe we've got the better of the virus. They start coming out in the streets. The social distancing, which is being enforced at this time, becomes loose, and people are meeting each other. Are you fearful that if something like that were to happen, then all the advances we've made, the gains that we've made so far could dissipate? And you mentioned reverse migration, people going back to the villages, and that could then spiral in areas with very limited healthcare facilities.
Oh, absolutely. I mean, 75% of our health infrastructure is in the urban areas, Rahul. So if rural India were to see this outbreak, this contagion, we would be in a very bad situation. But I think that is why you also have to see that the initial Janta curfew that the PM invoked, I think people didn't get the severity of it. Right? Because I think we got the sense that social distancing is important, but very quickly we also realized that people were out in the streets and there was a sense of a celebration. And I think that is why the second message that the PM made to the nation was far more somber. It was very, very concerned message that he put out. So I think this kind of a messaging has to continuously go on. Because just because I'm not infected or someone around me is not infected, or at least we don't know because we haven't tested, that doesn't mean that we are okay, we are safe.
It's a very important point. And Brahma Mukherjee, the other concern that I have is about testing. A lot of people internationally are raising the question that are these numbers what the level of the pandemic in India really is? Are they truly reflective, or are they understated because India isn't testing quite as much as some of the other countries? I have over here some data compiled by the India Today Data Intelligence Unit, which essentially makes the point that in comparison with other countries, the level of testing in India is far lesser. In India, tests per million people is just 20, and in the United Kingdom it's 1,700, in the US it's 2,400, in South Korea it's 7,000. So the level of testing in comparison with other countries is far lesser. Brahma Mukherjee.
Yes, thank you, Rahul, for that question. This is incredibly important to ramp up testing right now, because the last few months have been a collective failure of our societal imagination. Because if we act on the facts on the ground, that's not what the reality in 2 weeks is. And that's the difference between a linear and exponential growth. And it's incredibly important to ramp up testing. So Iceland actually did randomized testing in partnership with a pharmaceutical called Decode Genetics. So you could fill out an online form and get tested. And they have incredibly valuable data to feel the pulse of the epidemic, that where is it happening? Because the asymptomatic transmission is the dangerous thing. And that's why everyone has been taken aback by surprise. So it's incredibly important. This lockdown gives us time, buys us time to set up that testing infrastructure, that surveillance infrastructure. So lockdown is not the solution. Simultaneous contact tracing, ramping up testing, testing at the community level, testing randomly to get a sense of the whole country where the new hotspots will be coming up is incredibly important, because right now we really do not have any idea what the total number of cases is. And if you follow some simple calculation, that if you trace back that behind every death is about 800 to 1,000 cases, then you definitely know that with 25 deaths, you have more than 1,000 cases in the population.
Now, Matthew Fox, the critical question in a global perspective is, why is it that America's medical facilities are being overrun and the number of corona cases in the United States is spiraling? And this is especially important in the Indian context, because when people see what's happening in the US, they say, if this can happen in a country like the United States, then God forbid what can happen in a country like India if things start to go wrong. Why is America messing up so badly? What are the lessons there from India, mistakes India simply cannot afford to make? Matthew Fox.
I think there are two reasons. The first one is that we delayed action, so we didn't shut down the areas where the virus was spreading fast enough, and we didn't we still haven't instituted any national lockdowns the way that India has. And the other reason is testing. We had a delay in getting testing to the communities that need it. We still have delays in testing, and we're not able to test on a large scale to be able to identify where the outbreaks are actually happening, to be able to act as quickly as we need to. Those are scaling up now, and that is going to allow us to hopefully take action that's going to bend the curve. But I think the lessons are action as quickly as possible is what it's going to take to prevent large-scale outbreaks.
Talking about what happened in the United States is important, because a lot of people in India wonder, do we really need to go through such a long drawn out lockdown? And the answer very simply is yes, because if you don't, if the governor of New York is saying that New York City could be overrun in 10 days, they won't have enough ICUs, they won't have enough ventilators. Imagine what may happen if the virus gets out of control in a country like India. For the time being, Brahma Mukherjee, Shamika Ravi, Professor Matthew Fox for joining me on the Newstrack. Thank you very much. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.